نبقى الآن مع كلمة ممثل منظمة الصحة العالمية الدكتور داود الطاف. تفضل.
Assalamu alaikum. His Excellency the Health Minister, Deputy Minister for Ministry of Agriculture, and Deputy Minister for Ministry of Public Health and Population. Bismillahir Rahmanir Rahim. We know that vector-borne diseases remain one of the major public health concerns globally, as well as nationally in Yemen. And the magnitude requires bigger efforts that we are doing so far to address the problem and to tackle the issue and the concern of transmission of vector-borne diseases. As we know, 20% of overall infectious diseases burden is lying with vector-borne diseases globally. And in our region, Eastern Mediterranean region, we have 17% of burden of diseases for vector-borne diseases for all infectious diseases, where 11% of all overall vector-borne diseases globally is within our region. And in Yemen, we have 2/3 of the population at risk of fatal malaria form, which is falciparum form, out of which we have 1% fatality rate, where about 1/4 of a million people are infected by malaria annually, based on the report of 2012. Of course, we understand that it is beyond health. It is, involving other sectors based on the determinants that we have for vector-borne diseases, where many human interaction with environment, particularly development interventions, and especially the irrigation projects as well as the housing projects, is very much determining the conditions for breeding of vectors that are responsible for transmission of vector-borne diseases. And by the same token, the intervention requires involvement of many sectors beyond the health sector, particularly of education, the environment, agriculture, water and sanitation interventions. They are required to work together to channelize their efforts in a way to synchronize and integrate efforts and responsibilities to come together for an effective and efficient response and addressing of the issue of vector-borne diseases together. And that is the requirement of the time, and this is why I think this plan is very much towards that direction, to bring different sectors together and work together to have a more efficient intervention to address the problem of vector-borne diseases and especially dealing with the vector itself, while Ministry of Health or the health sector is specifically dealing with the patients and treatment of different forms of vector-borne diseases. However, to deal and address the problem of vector itself, we need to work together with other sectors to address the problem and reduce the population of the vectors, and to reduce the transmission of the diseases from the breeding sites all the way to the patient, and vice versa. So this is very much in line with the global consensus that we need to work through cross-sectoral collaboration to address this problem. Welcome all the participants, and wish you a successful discussion and recommendations and consensus on the strategy for the coming 5 years. Thank you so much.